Anemia or anemia, (ANEMIA), also spelled anemia, is usually defined as a decrease in the amount of red blood cells, RBCs or hemoglobin in the blood. It can also be defined as a lowered ability of the blood to carry oxygen. When anemia comes on slowly, the symptoms are often vague and may include feeling tired, weakness, shortness of breath, or a poor ability to exercise. Anemia that comes on quickly often has greater symptoms which may include confusion, feeling like one is going to pass out, and increased thirst. There needs to be significant anemia before a person becomes noticeably pale. There may be additional symptoms depending on the underlying cause. There are three main types of anemia: that due to blood loss, that due to decreased red blood cell production, and that due to increased red blood cell breakdown. Causes of blood loss include trauma and gastrointestinal bleeding, among others. Causes of decreased production include iron deficiency, a lack of vitamin B12, thalassemia, and a number of neoplasms of the bone marrow, among others. Causes of increased breakdown include a number of genetic conditions such as sickle cell anemia, infections like malaria, and some autoimmune diseases, among others. It can also be classified based on the size of red blood cells and amount of hemoglobin in each cell. If the cells are small, it is microcytic anemia. If they are large, it is macrocytic anemia, and if they are normal-sized, it is normocytic anemia. Diagnosis in men is based on a hemoglobin of less than 130 to 140 gl, 13 to 14 gdl, while in women it must be less than 120 to 130 gl, 12 to 13 gdl. Further testing is then required to determine the cause.